Hi everyone, it's me, Melanie, your IVF nurse, and today I thought that I would do an updated video on the Gonal F pen. This is primarily because there's been a lot of talk about tips and ways to do the injection where you can get it done efficiently, confidently, and not taking a whole bunch of time. Now, the Gonal F pen is probably one of the easier pens as it comes preloaded. So I do have a demonstration pen here, and it comes in doses of 300 units, 450 units, and then the 900 unit pen. And there's always a little bit of extra overfill in the end, so I always recommend don't discard your pens until you've taken them to the nurse at your clinic. Have her eyeball it to see if you've used everything you can use out of your pen. Now, what you want to do is when you get your pen, it's going to look like this. So the medication is already in the pen. And what happens is that your box comes with your supplies, so the needles that you need. The alcohol swabs, you can use cotton swabs with alcohol at home, or you may get alcohol swabs that look like this from your clinic. Okay, you want to use a new needle, an alcohol swab, every time you're getting ready to do your shot. Now, once you get your confirmation of your injection and your dosing that you're good to start, prepare your medication. So Gonal F can be used as well with other medications, but like I said, I'm only going to do the Gonal F pen. So if you're using Gonal F, you'll see that there is this little window in here. Let me bring that up so you can see right there. And if you look really closely, if you've got a pen, you'll see that it reads 0. So anytime you're dialing your dose, when you take your pen out of the fridge or when you're about to use it, you want to make sure that it says 0. What you're going to do is dial it to your specific dose. So your specified dose is as per your protocol, and it can be anything from say 50 units if you're doing an insemination, all the way up to 250, 300 units of Gonal F. So I'm just going to take a little bit out of here. I'll do 50 units, so I'm going to dial that up to 50. And when you see that you've got the 50 units in the pen, and you may not see that very clearly, but you want to confirm that you do see the 50 units in the pen. If you've over dialed it, so say you're just not paying attention and you over dial, you can just turn it back to your dose. Okay, you'll notice I have not attached the needle on as yet. Once you've confirmed that you've got the correct dose, what you're going to do is take an alcohol swab, clean the top. So taking a new alcohol swab, clean the top. That's where you're going to attach the needle. New needle every time, so it'll have a seal on it. You're just going to peel the seal off and attach the needle by screwing it on until you get resistance. There is 2 caps on here, so remove the large cap, remove the small cap, or the green cap, as you'll notice, and then technically you're ready for the shot. Now, at this point, you might see that your pen drips, and that's just it priming itself. If it doesn't, it's minuscule in terms of the air. You're doing a subcutaneous injection. If you notice, the needle is quite small, if you can see it. I'm going to actually poke myself, so you see me doing an injection on myself. So try not to laugh if it takes me some time, because I don't normally poke myself. But what we're going to do in terms of prepping, if you need to apply an ice pack to the site that you're going to do, so your tummy, 2 to 3 fingers on either side of your belly button. So that's my belly button here, right here. So you want to go the outer portion, and what's going to happen is you're going to take, say, your ice pack, apply it just for no more than 10 minutes, not directly on the skin. You will need to wrap it in a cloth because you don't want to damage the skin, but 2 to 3 fingers far from your belly button. Take the alcohol swab. You're going to clean the area with alcohol. You're going to then pinch the skin. And some people will say that the more you pinch, the easier or the less stinging or irritation that you get. So pinching a good inch. I've got my pen here, and what I'm going to do is just go in. That's in. you can let go, and then you're going to push this to inject the medication into you. So this is just demonstration, this is just saline. So I can push this part of the pen, and as I push it, it's going to go all the way back down to 0. You want to wait about 5 seconds, 1, 2, 3, 4, 5, and then you're going to pull the needle out, okay? And then that's it. I'm not having any bleeding or anything like that, and I'm just going to go about my business. But if you do find that you're having a little bit of bleeding, so if you're taking aspirin or something like that, it is normal to have bleeding and slight bruising after you've done your injection. You'll notice that once I've pulled out my pen, there's a little drip there. Don't be too concerned. That's usually what the overfill is for on these pens. You do want to dispose of your needles appropriately. So what you're going to do, if you do not have a small medical waste container that allows you to open up the top, put the needle in, and unscrew, the needle comes off, what you're going to do is use your large cap and carefully just recap, unscrew, and then this would go into your gray medical waste bag. Your Gonal F pen would then get recapped, and if your clinic has advised you to store it in the fridge, you're going to put it back in the fridge. If you're keeping it at room temperature as per your clinic instructions. Now, the one thing about the Gonal F pen and all these medications usually is that once you've poked the top with a needle, it's only good for about 28 days. So if you've kept pens that are from a previous cycle and it's been more than 28 days, you shouldn't be using the medications that's left in here. You'll need to buy new pens. I hope you found this helpful. Please feel free to check out my website, www.yourivfnurse.com. If you've got any questions, please feel free to email me at yourivfnurse@gmail.com. You can check me out on Instagram at yourivfnurse, and you can subscribe to my YouTube channel or comment down below. Have a great day.